Hi, you guys. Welcome back to our daily practice questions. It's day 15. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. Question number 1 states a 58-year-old male presents with a gradual onset of hearing loss to the left ear over the past several months. He reports difficulty understanding speech, particularly in noisy environments, and a sensation of muffled sounds. He denies any history of ear infections, pain, or trauma. Upon exam, his otoscopic exam is normal and there are no signs of any external ear abnormalities. The tuning fork test to include the Weber and Rhine indicate lateralization to the unaffected ear and ear conduction is greater than bone conduction bilaterally. What is the most likely diagnosis for this patient? Is it A, sensorineural hearing loss, B, conductive hearing loss, C, otitis media, or D, tube dysfunction? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first as it allows you to slow down to assure that you're answering what is even being asked of you. So here the stem of the question states, what is the most likely diagnosis for this patient? And y'all know what I say. If they're looking for a diagnosis, you need to run it back and look at those assessment findings. How are they presenting? What are the signs and symptoms, right? What is noted on exam? What are their chief complaint? And then the 3 findings I always tell y'all to pay attention to, if they are provided, is the age, the gender, and the ethnicity, right? So this is a 58-year-old male, came in with complaints of gradual hearing loss to the left ear over the past several months. He reports difficulty understanding speech, commonly having these issues in more noisy areas. It sounds muffled. He denies any pain or ear infections or any trauma. On exam, the ear looks normal. Tuning fork test completed the Weber and Rhine. With Weber, it shows lateralization to the unaffected ear, and Rhine shows AC is greater than BC bilaterally. So, one, you need to understand the Weber and Rhine results. AC being air conduction greater than bone conduction is normal, correct? So our Rhine results are normal bilaterally. Weber shows the lateralization to the unaffected ear. Now, there should not be any type of lateralization. So this is abnormal. Now, the fact that it lateralized to the unaffected ear lets us know that this is a sensorineural hearing loss. So if it would have lateralized to the affected ear, meaning the ear that they are complaining about, if it would have lateralized to the left ear, it would have been conductive, right? All right, question number 2. A 45-year-old woman presents with a sudden onset of hearing loss in her right ear, which started after she had a cold with nasal congestion and a blocked feeling in her ear. She also reports a sensation of fullness in the affected ear and difficulty hearing low-frequency sounds. Upon exam, her otoscopic exam reveals a bulging erythematous tympanic membrane with some fluid behind it. Tuning fork tests show Weber and Rhine indicate lateralization to the affected ear and bone conduction greater than air conduction on the right side. What is the most likely diagnosis for this patient? Is it A, sensorineural hearing loss, B, conductive hearing loss, C, Meniere's disease, or D, acoustic neuroma? Take a moment and tell me what you got, y'all. All right. Stem of the question states, what is the most likely diagnosis for this patient? So same thing, we need to run it back. Look at these assessment findings. We have a 45-year-old woman, sudden hearing loss to that right ear, started after having a cold, congestion. She has this blocked feeling in her ear, a sensation of fullness, tympanic membrane, does have fluid behind it. Weber results indicate lateralization to the affected ear, making us consider, conductive hearing loss. And the Rhine result shows bone conduction being greater than air conduction, which is abnormal, right? And it's on that right side. So your best answer is B, conductive hearing loss. Remember, if bone conduction is greater than air conduction, that's abnormal, and you're going to think conductive hearing loss. And that Weber result lateralizing to the affected ear confirms that, okay? And y'all, if y'all struggle with Weber and Rhine, go to the playlist and on the home screen of my channel, and you can go directly to the Weber and Rhine section. I have videos on that and questions to help you with that too, okay? All right, question number 3. A 36-year-old male presents with a complaint of hearing loss in his left ear for the past few weeks. He mentions he has a history of frequent exposure to loud noises at his job as a construction worker. He denies any pain or discharge from the ear. On otoscopic exam, his tympanic membrane appears normal. The tuning fork results, Weber and Rhine, indicate that sound lateralizes to the left ear and bone conduction is greater than air conduction in the left ear. What is the most likely cause of this patient's hearing loss? Is it A, sensory hearing loss, sensorineural hearing loss? Is it B, conductive hearing loss? Is it C, earwax impaction? Or is it D, acute otitis media? Take a moment and tell me what you got. All right, so the hearing loss, this is still asking you for a diagnosis, right? So let's run it back and look at how they presented and what was noted on exam. So this is a 36-year-old male, came in with complaints of hearing loss to the left ear. So we need to pay attention to that. The affected ear is your left ear. He mentions he has a history of frequent exposure to loud noises due to his work, right? Denies any pain or discharge from the ear. On otoscopic exam, the tympanic membrane is normal. The Weber results indicate the sound lateralizes to the left ear, so even though that's abnormal. And then the Rhine results also show bone conduction is greater than air conduction in the left ear. So y'all, again, this is conductive hearing loss. There is something affecting the conduction, the sound conduction, right? The sound is lateralizing to the affected ear because he complained to the left ear. It lateralizes to the left ear. Bone conduction is greater than air conduction in that left ear. It is conductive hearing loss. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if y'all need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1 at gmail.com. All of the things that I do offer are linked in the bio of this channel, including my website. But as always, if you're looking to book any of the one-on-one sessions or any of my customized tutoring packages and sessions, I always say either call, text, or email because I prefer to speak to y'all first to gauge what you truly need to make sure you're booking the appropriate session type, okay? But all right, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.